Hi everyone, this is Bridget Bedville from the Criminal Justice Commission. This is the Impacts webinar application Q&A session. It is May 18th. We actually recorded this earlier, but unfortunately the entire recording did not record. So in order to make sure everyone has access to this in its entirety, I am recording this again by myself. So I will go through all of the things that we did this morning in the first go. And luckily we have all of the questions from this morning saved. So I will make sure to repeat those questions and answers at the end so no one misses out on what was discussed already. So first things first, let me get to our PowerPoint. This will be the first half of our conversation today, our presentation. And so let me make sure I am sharing my screen. Alrighty, so first, if you are familiar with impacts, you probably know that impact stands for improving people's access to community-based treatment, supports, and services. And where did this grant come from? This is a program that was devised in the 2019 regular legislative session and is really focused on members of our communities who have serious substance use disorders, mental health disorders, and who, because of those issues, are cycling in and out of jails, emergency departments, and perhaps the state hospital, or a combination of those circumstances. And the funding that is available through this program is aimed at helping this population get treatment, supports, and services at the appropriate level of care in their communities. So no one is discouraging folks from going to the emergency department or the state hospital, if they need that for treatment, but oftentimes members of the target population that we're discussing today are seeking out those services because they don't have sort of regular routine care or other access points to the treatment that might actually be more helpful for them. So the point of this funding is to increase and expand community supports and services and decrease shortages of those programs all across the state in Oregon counties and in Oregon's federally recognized tribal governments. So that is sort of the overview, the basis, and of course the target population is the sort of shaded area in our Venn diagram of folks who overlap between those two circumstances. So the Grant Review Committee is the funding decision maker for all of the impacts program funds. It's a little bit different if you're familiar with CJC grant programs like Justice Reinvestment or Specialty Courts or Illegal Marijuana. Those are decisions made, those are funding decisions made by our commission. Impacts is different because the legislature set it up as the funds sit with CJC, but it is sort of a joint project. We are consulting, OHA is a consulting agency, so we're teaming up with OHA. And the Grant Review Committee is this 19-person body appointed from all three branches of government, and they make all decisions. They approved the administrative rules, they approved the application, the RFP, and they will make ultimately all of the awards decisions for who receives this grant funding. So it is sort of an independent administrative body, not the CJC's Board of Commissioners, not OHA, their own body. So just in case there's any confusion about who decides what, it's our Grant Review Committee. The funds available are $10 million. That is the total available. The Grant Review Committee may set aside a portion of those funds for technical assistance projects. They haven't done that yet, but they certainly may. It may be that once all of the applications come in and they see what the overall request for funds was, that might help them decide, what to allocate for program funding versus technical assistance or something like that. We will see. This is a competitive grant program, not a formula, for counties and regional consortia of counties. For tribal governments, the 973, Senate Bill 973 said that there shall be a tribal set aside of funds. So the Grant Review Committee will determine what amount of the total $10 million will be set aside for tribal government awards. That award or that amount will likely be determined at our next impacts meeting, which Today is May 18th. That next impacts meeting is May 19th, so tomorrow. So we'll know soon, and that's likely to be decided tomorrow. It's on their agenda. If tribal governments were to, submit applications for requests that exceeded the amount of funds set aside, they would be, the grant review committee may, if they wanted to or found it to be appropriate, set aside or make available more funds than the set aside amount. So it's not as though tribal governments are capped necessarily at the set aside amount in total. It's really up to the grant review committee about that. So we will know soon what the tribal set-aside amount will be. Applications for everyone are due on June 12th by 5 p.m. If for whatever reason it's 4:50, 4:55, and your computer decides to update or something, something just goes wrong and you don't get your application in by 5, please email the staff and just tell them what the problem was, and we will help however we can. That's whatever grace period is not infinite, but we are humans who want you to succeed. So if you have any trouble with that, 5 p.m. being the cutoff, just let us know and we will certainly see what we can do. So who is eligible for impacts? The sort of 3 iterations are county governments, federally recognized tribal governments, or multiple counties or multiple tribal governments applying jointly as what we call regional consortia. So you may be comprised of, that could be an application that has 2 or 3 counties banding together to create a proposal. It could be a tribal government and a county. It could be a couple tribal governments and a couple counties. It's really any combination of those entities. What are the submission requirements? So Senate Bill 973 set forth that county applications must be submitted by your local LPSIC on behalf of the county. Tribal government applications must be submitted through your tribal government council or your government body. And regional consortia applications must be submitted by either the LPSIC or your tribal government, whatever the consortia chooses. So if you have 2 counties applying together, whatever LPSIC wants to be the sort of sole applicant, go ahead and submit. If you have a couple of tribes applying together, you would select whatever tribal government was going to be the applicant government. And then of course, your proposal can include everyone, but you have to have one person submit or one entity submit. So what are the impacts program priorities? These are a summary of other sort of a more verbose version of this that is in the request for grant proposal. So just real quick, everything we cover today in the slides is from the RFP. So if you're looking for more information, look to the RFP, and if something is not answered there, please just let staff know and we will get you an answer. So first things first, adhering to the program statutory purposes, that the information from Senate Bill 973 about making sure that we're getting the target population, increased community supports and services, so folks are not winding up in jail, the emergency department, and or the state hospital in sort of a cyclical fashion. That's kind of our top priority. So what is your program going to do to meet those needs? Second here is tracking, evaluating, and measuring system data and grant-funded program outcomes to improve both your impact program and sort of the umbrella impact program as a whole. So collecting target population data and program data and really keeping track of what's working and maybe what's not working so successfully is going to be really critical to both a compelling application and as well you just overall program success. So make sure you're kind of thinking about those things when you're crafting your proposal. Third here is strategically leveraging limited grant funding resources by supporting a select number of programs. This is basically saying, $10 million is both a lot of money, but also given the sort of breadth of the needs for behavioral health care and its intersection with the criminal justice system, it is unfortunately not enough to fix everything. So what are the ways in which you're going to describe how funding your program would be strategic? So the sort of A through E here, how are you going to be willing to participate in data sharing and analysis? How much have you, what degree have you evaluated your local system gaps? Like what do you need? What do you not have? What do you have in available supports and services for your target population? What comprehensive services will you be able to fund with the additional assistance of impacts funding? How have you already exhausted your local solutions and resources to serve the target population? What are you already doing? What have you already tried? And what more do you need to do? And then, how will the funding level you requested be significant enough to make an impact locally? Like, how are you going to justify what you've requested in terms of funding to do what you say you will do? So what are, some of the allowable uses for program funds? These are budget categories. They're pretty standard if you've been part of other CJC grants, or, other grants. These are pretty standard budget categories. The one thing I would point out here is that for this program, rent and utilities is for program staffing. So if you need to rent an office space and pay for a phone line to do some sort of mobile crisis unit, you would put that in rent and utilities. If you are looking to fund supportive housing for your target population members, or a couple, a few of them, or half of them, or something, you would put those requests in your housing assistance section. So that's why those two things are distinct. And one thing we recommend is that most grant requests will fall into one of these categories. If your request really does seem like it's an other category, go ahead and put it in other, but also feel free to ask questions about where you might put something if it's not clear, because other is actually pretty rare that we need to use other, but you are welcome to if you need. So what are some examples of allowables? This is not an exclusive list. These are just examples. I won't read them all to you, but peer supports and services, mobile crisis services, adding capacity to any sort of crisis unit or detox center, really adding capacity to any sort of impacts style program you may have already been operating, or maybe something you're interested in starting. Really the point here is, programs that are aimed at diverting your target population with behavioral health issues from the criminal justice system, and then, what ways can you afford them healthcare, the right kind of healthcare that they need, that isn't necessarily just going to the emergency room in crisis over and over again. So you have license to be innovative and collaborative. It does not need to be something you see in the four corners of this list. It can be whatever sort of you need to tailor to your local circumstances. If you have questions about what do does this sound like it would qualify? Staff, we don't make decisions about what is or isn't an appropriate program, but we can, point you to portions of the RFP or the administrative rules or the Senate Bill 973 that created this to try and help guide you in determining whether you think it's an appropriate program. So what are the unallowable uses? This is a shortened list. See your RFP for your complete list. Really the one I think that is most important to point out is supplanting existing funding for program services or supports already in operation. That is, I think, important to talk about, particularly given the circumstances everyone is under concerning budgets, given that we're in the midst of a pandemic and everyone is trying to figure out how they're going to do budget cuts and things like that. So while, again, as staff does not get to determine what is and is not supplanting, strictly speaking, but if you are in a position, this is a question I've been asked a number of times, so it is worth kind of fleshing out. I'm already operating a program that is sort of fits within the parameters of impacts, and I'm concerned that my, let's just say, government is going to, my local government is going to cut a bunch of our staff because we don't have the revenue to pay for them anymore. Would it be supplanting if I asked for funds to pay for that staffing to continue under impacts? And like I said, I can't tell you definitively one way or the other, but I mean, what I would do if I were you is I would make the distinction very clear in your application why this is not supplanting. This is allowing for the continuation of services, why those services fit within the impacts profile, and just be very clear about how this will add capacity to benefiting your target population. So really, the bottom line here, in fewer words, is please be specific as to why this funding is sort of the thing you really need to continue these services and add capacity. So the rest of those unallowables are pretty straightforward. I think everyone's seen them before, so I won't belabor those too much. And like I said, if you have any questions about is this allowable or not, feel free to call and we can help you walk through that. So who is the target population? This is probably the most important definition to understand in the Impacts Grant Program, because these are the folks that your funds may benefit. The target population means individuals who receive services and supports funded through the Impacts Program who have one or more behavioral health disorders and are booked into jail an average of 4 or more times in a 1-year period, or are high utilizers of criminal justice resources, hospital or urgent healthcare resources, or institutional placements. So we will get into, that either or, sort of 2 ways to define your target population here. First is booked into jail 4 or more times in a 1-year period. That is because data shows that if you're being booked that often, the likelihood that you've got a bunch of other sort of risk needs factors is much increased. So if you have information about your target population, or you suspect that the contingency of folks that you are focusing on are persons who are booked 4 or more times in 1-year period, that may be the way that you define your target population. However, if you have folks who are high utilizers of criminal justice or hospital, emergency department, urgent care, state hospital resources, but maybe aren't being booked every time. Maybe they're being picked up by your mobile crisis officer or some other, mobile crisis unit, crisis intervention team. Maybe they're being picked up by your behavioral health care staff and taken to a shelter or treatment or wherever. Maybe they're just not being booked for some reason, but are still frequently churning through having contact with law enforcement, having contact with emergency services, emergency departments. You may also define your target population within those parameters. The way you would do that is just be very clear as to how, what are the components that allow your target population to fall into those. How are you measuring those things? So be sure that you are very clear about these folks are getting intervened by with police officers this many times a week approximately. They're going to shelters, we're going to emergency departments, all these things. So just be very clear as to how you are measuring high utilization. So application contents, there's kind of 5 core pieces that are broken down into smaller pieces. First, your cover sheet with contact info and fiscal information. We will be in the second part of this little presentation. We'll be going over the actual online application, so you'll see where all of this stuff goes. Your program proposal narrative really explains, this is the stuff we want to do. This is the target population we are talking about. Here's how we identified that population. Here's how we plan to share data. These are our community supports and services we propose. We're going to explain all of this. This is how we will sustain this program with both the funding through impacts and other funding sources that we will either, we already have available or we will seek out. So this is really the proposal. The program proposal narrative is where you explain to the grant review committee who your target population is, how you identified them, what they should understand about your local community, and how you plan to do all this data collection, sharing, what data you have available, and then what you plan to do with all that information to support your target population. Are you going to staff a mobile crisis unit? Are you going to hire peer support services? And really one thing I would be clear about is if you ask for a position to be funded or equipment to be purchased, make sure that you can tie that back to your program narrative. If it hasn't been explained as to why you need something in your narrative section, it's a lot harder for the grant review committee to understand why it's in your budget. So just make sure that you can see it in both places. And of course, then there's the Senate Bill 973 has its 4 required elements, which we'll go over in a second. You'll have a budget overview form like I just described. If it's in the budget, your line item, we're going to ask for this many hours of personnel contract. We're going to ask for this many hours of service contract or treatment contracts. We're going to buy this much in supplies, etc. Make sure it's in both your budget detail and your narrative. And then, of course, because most, virtually all grants have sort of additional requirements for reporting and financial reporting, both program and financial reporting, you'll need to acknowledge that you accept additional requirements if you are selected for funding. So what are Senate Bill 973's required elements? These are things that if you've been sort of tuned into impacts, you probably are familiar with, but if not, I will go into these each in detail in the next slide. So first, letters of support and commitments from your community leaders, medical assistance screening agreement, tribal notification process plan, and county tribal government input report. So the letter of support and commitments from your community leaders should include, including but not limited to agencies working with your homeless or houseless individuals, behavioral health care providers, CCOs, and or local hospitals who are participating, with you in this project, or who would support your project. You don't have to have every hospital in your jurisdiction sign on if you're in a bigger place. Just who is involved, who is supporting you. Really, the aim here from the legislature was they didn't want this to be solely criminal justice supported. So, if you go through lipstick, maybe you'll get your sheriff and your presiding judge and many other folks who may be sort of more in the criminal justice role. This is to ensure that you have collaborated in the design and sort of creation of your project proposal with a multitude of folks who would be supporting your target population in sort of a healthcare and other human services way. And to try and make sure that this is not, all of these elements are not so onerous that it's impossible to complete this. If it's easier for your jurisdiction to have all of these organizations sign a single letter, like you have one person draft it and get everyone to sign on, that's acceptable. It's also okay if you want to do separate letters, or if a particular organization wanted to write its own letter. Just make sure you get all those together and put them in your app. Medical assistance screening agreement. This is essentially if for any person who's in your target population to be eligible for impacts funds, you, the applicant, and all your program partners who would have the opportunity to do this, you have to agree to screen your target population for eligibility in public medical assistance, aka the Oregon Health Plan. I know a lot of places are already doing this, but if you're not, this is something you would have to do to be eligible for funds. And as you'll see later on the application, there's just a box you would check that says, yes, we will do this. And then later in program reporting, you might be asked for how many members of your target population are enrolled in OHP, or how many did you screen this month, that kind of stuff. That's why that's important. The next is county tribal government input reports. So this is a requirement of both counties and tribal governments for how they garnered input from the tribal government or county in their service area on the design of their impacts program. So if you are essentially designing your impacts program and you have a tribal government in your service area, or you're within a tribal government service area, you would need to reach out to that tribe or that tribal government and let them know, this is what we're proposing. Do you have any feedback about how this could work better? Same goes for counties, for tribal governments of counties. They would need to reach out to the local county and say, this is our program design. Is there any input you would have or feedback you might have about how this might work better? There's no requirement that everyone agree on everything. There's no requirement that everybody sign off and say that we 100% endorse all of this, but there should be evidence that you made the effort to get input from those entities. So in doing that, the consultation report, I know report is a pretty formal word. It doesn't need to be a report. It may be any evidence that demonstrates that effort. Could be a letter or multiple letters or emails or a series of emails or any however else you would document that effort was made. And for regional consortia who are drafting applications that involve joint county tribal governments applications, you are exempt from this consultation report, because by the very nature of your joint county tribal government application, the input has been garnered. If you're working together on an impacts program, then by its very nature, you have already asked each other what you think about your proposal, because you're submitting it together. So, and for folks who aren't sure about, what is the tribal service delivery area, here is how this is defined by federal government. And this is the list that our 9 federally recognized tribes of Oregon use. So if your county is on the right side here and you are submitting or looking to submit an application, you would need to reach out to the tribal government on the left. And tribes, if you're looking to apply for an impacts application, whatever county that you're applying for in your service area, you would need to reach out to them as well. We'll send that list around. I know that might be new information for some folks. So tribal notification process plan, this is a bit different. This is something that I've not encountered many jails or participating hospitals doing yet, but there might be. This is essentially if you have a member of a tribal government as part of your target population and you encounter that person either during a jail booking or during a hospital admission, you need to have a plan in place for how you would offer that tribal member the opportunity to contact their tribal governments and disclose their circumstances. So whether they are being booked or whether they're being hospitalized or admitted to a hospital, they have the option to let their tribe know. They don't have to, it's not a requirement. They can totally say, nope, I don't want to do that. But you as the participating entity, the jail or the hospital partner, program partner, you need a plan in place to offer that to folks. So understanding that not a lot of places are doing this, as far as we've heard, if you don't have a tribal notification process plan in place during this application period, what you can do is you can submit a description of how you would do this, a proposed tribal notification plan, and if you're awarded, you will have to implement that plan before your first disbursement of funds. So if you are awarded the funds that a portion of the funds that you requested, before we can release the first payment to you, you will have to get all those pieces in place and make sure that you explain to the grant review committee that this is up and running and now we can receive these funds. So how will the grant review committee review the applications that come in? This is a bit of a condensed version of what is in the RFP, but essentially completeness of your application. Did you describe everything we wanted you to? Did you answer all these narrative questions? Did you describe what data you have available in the online application? Number 2 is essentially a continuation of what degree to which did you describe your narrative and your local system assessments, how you determined your target population methodology, how are you going to maximize the programs and supports that exist, and how will you integrate impacts program funds and services into what it already is existing in your community. Basically, how well did you explain what you are currently doing, what you'd like to do, and how impacts will make the difference. And then third, there's a sustainability narrative, sort of an extension on some of that is, how are you going to support your impacts program project through more sources of program funding than only impacts, because impacts is a relatively small grant given the nature of what problems the state is trying to fix. So if you have federal funds, or if you're, folks are on the Oregon Health Plan, or if you have a SAMHSA grant you're applying for, or maybe another state grant that you're also applying for, federal grant, all that good stuff. Make sure you explain how those other sources will be braided together to support your impacts program. And lastly, the grant review committee may consider other factors that it deems necessary. Let's say maybe a bunch of applications came in all from one part of the state. The grant review committee may, it's not required to, and this is within its discretion, decide that we want to give extra weight to an application in a different part of the state so that geographic representation is honored, or something like that. That's just one example. If you're not on the interested parties list for the Impacts Grant Review Committee already, so if you are on the interested parties list, you'll be getting the meeting agendas and meeting notices. If you aren't getting those, please email me so that you can get added to that list, because that's how I communicate with the folks who want to apply and get information out to them. So for example, we'll be sending out that tribal service areas list that we had a screenshot of earlier in this presentation and a Word copy of the application. That's so you can email it around and have it in an easily editable format so that going to the online application, you don't have to have everyone log in separately because that's very annoying. So you can have just one person put it all together and input. So if you'd like to be added, email me. I'm Bridget. And just in case I didn't mention this, I am certainly not the only staff person on Impacts. We have Casey Lewis and Angel Perrin from the CJC. We also have Kate Grover from OHA and Madeline Dardo from the Council of State Governments as our technical assistance provider. So any one of those folks can help you out. We also have on the CJC's website an Impacts page. So if you go to our front page, there's a little Impacts icon you can click on, and there's a copy of the RFP, and there should be a copy of this presentation and contact information for those folks. So, all right, that is part 1. We will now go to part 2, the online application walkthrough. Okay. So this is the CJC's grant management website. This is something we use for all of our grants. You may have heard of Justice Reinvestment or Specialty Courts, the illegal marijuana grant. This is the same website, but this is Impacts, of course. And if you are new to this website, the link is in the request for grant proposals, and you just need to register and make a username and all that good stuff, and then start your application. So this assumes, the screen in front of you right now assumes that you have done that. So first things first, we'll go to the Impacts cover sheet. So here we'll go through just kind of the steps you would need to fill out this whole application. First, I just want to clarify, you're going to see a lot of goofy rabbit names and dog names. This was just to make it very obvious that no actual entity, county, tribal government, anybody was the inspiration behind any of these examples. These are just silly examples, so bear with me. So first things first, you've got your grant application contact person. This is going to be the person who is kind of your point person for any questions that staff would have. So if you submit an application and it looks to me like you forgot, maybe you didn't include a letter of support or something like that, or your letter of support didn't have any signatures on it, who would I contact to follow up with you and ask for more information? That is who you're going to want to put here. And of course, you've got your, their entity, contact person, email, phone, all that good stuff. And apologies for the sort of, you have to scroll over. The user interface leaves a little to be desired, but it's what we've got. So next portion is the Impacts application participants. So who are your, if you are a sole applicant, you're one county or one tribal government, you just put yourself, however, what your name is. If you have more than one, or if you're a regional consortia, that's where you'd list anybody who is sort of jointly applying here. Next is if you have any program partners who are local, your local urgent care, your local behavioral health provider, whatever, you would put those folks, whoever was participating on the healthcare side, in here. There's where you would put any sort of law enforcement agency. This is, if your local jail is collaborating with you, you would, maybe put the name of your sheriff or your jail commander, whomever would be the contact there, or your police department if you're doing a mobile crisis team, that kind of thing. And then here is any other, not healthcare, maybe not criminal justice, maybe nonprofit or reentry services, or anybody who doesn't fall into the other two categories. Maybe your housing assistance folks would be in here, but other program participants who are working with you, you put them in here. So next is your grant team fiscal contact. This could be, this may be the same person as your grant primary contact, but sometimes different entities will have maybe a business administrator who covers all of the fun stuff. So if that fiscal agent is different than anybody you've listed as the primary contact, please put that person here. This would be if we had questions about your disbursement or the timing of funds or anything about essentially how to get you paid, this is who we would want to talk to. And then this last question here is, if you're awarded grant funds, do you want direct deposit? Click yes or no. So we will go there. And actually, we will go here. Go to the next page, okay? So this is the program narrative. This is, where you put in sort of the design of your program. And all of this up here is stuff you're going to see in the RFP. So I won't belabor that. The target population is the definition we've described already. So the first question you're going to be looking at is, what is the number of individuals that you believe to be eligible for inclusion in your target population? Give us a number. So you may have already identified exactly how many people through one or more of your sort of, the background information that you gathered for applying for this, and so you might know it's 40 people. If you are still estimating based on, gathering information, go ahead and provide your best estimate, but try to be realistic. Try not to, overshoot just for the sake of overshooting. I would just try to be really deliberate about, this is who we actually think we want to target. These are the folks we want to help the most. And that may be 10 people, that might be 50 people. It's really up to, how you define your target population. So the second step, of course, is defining your target population. You have, like we described earlier, you have two ways of doing it. 4 or more bookings into jail into a 1-year period. That's one way to get there. But your information on your target population may be that they're high utilizers of criminal justice, healthcare, or institutional placements, but maybe they're not getting booked 4 times or more. So if you are selecting this, like I did as this example, you would go then to 2B and describe, how you got to that answer. So is your high utilizer population going to sobering centers often? Are they being picked up by your mobile crisis unit often? I would really focus on describing, what does high utilizer mean in your community? And, what are the ways in which you can measure that? Is it, interactions with law enforcement that are outside of a jail setting, just sort of being picked up? Is it being driven to your local shelter? Is it what kind of things make them frequently involved with healthcare, criminal justice, or the state hospital? So part 3 is really any additional information. This is local contextual information that describes to the grant review committee what they should know about your local community and how your target population exists within it. So what about your community makes your target population vulnerable? What supports do they have? What sort of local issues make your circumstances unique? What are your local resource challenges? This is what you want the grant review committee to understand about the background within which you are applying. Your data sharing plan narrative is, there's clearly a focus on data here, collecting data that's going to allow you as the participant and then the grant review committee as sort of the administrative body to determine what's working well and what to support further in the future. So this would be you describing how your partners, the folks involved in your program proposal, are going to collaborate on data collection, tracking, sharing, and protecting that data for the confidentiality. So one thing to think about here is who will be doing what, and I would emphasize that explaining that in your plan narrative would be a good thing to do. So identifying who will be tracking, to whom you will be sharing, and who will be sort of apprised of how to protect that data, etc. would be good to identify early and explain to as much detail as you can in this narrative. This next portion is of these data points. This is essentially check all of the target population data that you think you'll be able to identify within your target population. Check all that apply. So the more you can check, the better, of course. But if not, we will have technical assistance to help you put some of this together if you are awarded. So that is one thing to be thinking about. And I think the next question is really a better place to talk about that. So, baseline data as described in the slideshow is a really important component of impacts. And that may include the things, the data points we just discussed, age, your demographic information, your behavioral health care needs, your risk needs assessments if you have them, those kinds of things. For programs that are awarded funds, you will need to submit baseline data for things like that from your target population before your first disbursement of funds. So if you are awarded funds and doing that becomes a challenge, maybe getting your jail booking data synced with your healthcare data in a de-identified way or something like that becomes a real challenge, we can help you with that. We can help sort of troubleshoot. Obviously, you need your local folks really involved in making sure that's all done. But that is something you will have to accept as a requirement and deliver before your first disbursement of funds if you're awarded impacts funds. So that's where you check there. Next is community supports and services proposals. This is where you're going to explain to the grant review committee what you want to pay for. What are the community supports and services that you would like your funds to expand, support, cover, those kinds of things. So, what added treatment or what housing or what are the ways in which you're going to take all of this information you're putting together and put to good use. That's what I would focus on there. And I would also say, the more specific you can be, the better. Really, identify who would do what. If you have any sort of local program goals, those would also be really good things to add to your supports and services narrative. So for program sustainability narrative, this is, like I was talking about earlier, how are you going to essentially build upon the existing funding streams you have for your target population with impacts and, describe what sources of funding are available to you that you're going to use to sort of make stretch impacts a little bit further. Are you using, everyone has to be screened for your target population for OHP. How many folks are you going to get on OHP? Are you eligible and seeking out any federal funds assistance? Is your local government paying for, staff people or a building or those kinds of things? Medicaid, other grant programs that are not impacts. What are you going to do to sort of braid more than one funding source together to support this proposal? And if you have any questions about, further questions about what that really means and what detail you should give, feel free to give us a call or an email. But yeah, the more specific you can be, the better. But I would just try and describe all of the sources that you're looking for or are already getting. And of course, medical assistance screening agreement, we talked about that. It's one of those 4 Senate Bill 973 components you have to do. This essentially says, I agree as part of this application that our program will screen all grant participants within the target population for their eligibility for public medical assistance. So in Oregon, OHP. You will accept that and good to go. And then the last piece here is, we talked about this earlier too, acknowledgement of additional requirements if your proposal is selected for funding. So as is true of virtually all grant programs, once you're awarded funds, there's routine, fiscal reporting or financial reporting, program, progress reports, how much, what services have you been able to provide? What equipment did you buy? X, Y, and Z. How many staff did you hire? Those kinds of things. That's pretty routine for grant reporting. Those will be requirements of any proposal that is funded. And there may be other additional terms and conditions just that are standard of grant awards, in addition to the things we already discussed, like baseline data and so forth. So you would select there that you've accepted that requirement. Make sure you always hit save, because you know how that works if you don't. The next page is our budget sheet. So the budget sheet is essentially the framework within which you're going to explain the costs that you're looking for, the costs you're asking for. So in those budget categories we covered a little bit earlier, we have personnel. So here you will put in a position type, your monthly wages, salary plus any fringe. This employed how many months during the grant period? Like if this person needs to be hired and it takes you 4 months to hire him or her, you probably shouldn't put 24 months because it took you 4 months to hire them. So how many months will this person actually be on the job in your impact program? If it's more like 20 months or 22 months, I would put, that's what you need to put. Also this percent of time per month, just think of it as, instead of putting 0.5 FTE, think of it as 50% or 75% or 100% if they are full-time. And then you would just put, whatever employing agency, like to whom will they report for work. And then there's, a number of position slots you can fill in. For, new hires, we ask that folks say, if you're going to be hiring new staff at these funds, do you agree to post these positions within 45 days? Yes or no? That's just to let us know that you actually posted them and we can kind of keep track of the money that's going out the door, so we know it's going to be used in the time frame that we need it to be used in. New hire positions filled, will you let us know when you have hired folks, if you have, if you're doing hiring, because sometimes hiring can take a little time. Contractuals, pretty straightforward. Personnel, whatever the contract purpose is, maybe you're contracting for treatment hours for in your jail from a nurse, however many hours you plan to use during the 2-year period, approximately, what the cost would be per hour, and then the agency served over here. And the rest of this is pretty straightforward. Equipment, you do the same thing. What equipment do you need? How many units do you need? What's the price per unit? And then who will it serve? Same thing for supplies. One thing I would like to point out for travel and training is, let's say you're doing a telehealth training, like a virtual training. For this portion, you would put in the number of folks you are registering. So let's say you have 4 staff people who are going to be participating. Here, instead of putting that it costs $100 per person, you're going to put the total. So if each of those 4 registrations costs $100, you would just put the total $400 registration fee. I know it's a little bit different than the rest of the form, but it's just how these form calculations work better. So just trust me on that one. Travel and training, rent and utilities, the same. I think the rest of this is relatively straightforward in terms of how to fill out. Just units, description, agency served. Administrative costs, there's, if you plan to ask for some administrative costs with, the staff time it takes to run this grant and do the reporting, you select yes or no. And then if you selected yes, you would put down here, who would be doing that. So let's say it's Rabbit County business analyst or something, you would put here, and then the total cost of that person's hours within the grant period. So just do some math there and let us know your sum. So we would save this if you're going to continue editing, but we're done, so we're going to mark it as complete. And then the last parts are where you're going to upload those component parts of your application. So we're going to go to letters of support. Here, this is the description of what you're looking for. And this is where you would attach as many letters or files as you would need. It might be in one single letter, that's fine. It may be multiple letters. I know we've got this kind of fun link to video. I would probably suggest sticking to letters, but if you've got some fun additional video that you want to submit, like, it's an option, so you do you. The same is true of consultation reports. Attach whatever reporting evidence or information you have, your email or your letter or your series of emails. And then same goes for the tribal notification process plan. Describe, what plan you would put in place or already have in place, and then attach it here. So that is the application. You would mark that, well, so I'm not done, so I can't mark it as complete, but that is, the finished application. And once you're done with that, you submit it, and do that before June 12th. So before we are done, I want to make sure we run through the questions that were asked this morning. So let me turn to that real quick. So let's see. First things first. Okay. Our first question is, can this funding be used for sobering facilities as those services are not billable? Yes, if you are looking to staff a sobering facility, you may use impacts funding to do that. You would just put in, this is what it's for in the description and hours and, what it would cost per hour, those kind of things. If you were hiring someone, you'd put it in personnel. If you were contracting with a provider, you'd put it in, contractual services. You may, this funding is eligible to be used for making renovations to things like sobering centers. I think it would be prudent to be careful about that, just because it's grant funding, so it's very limited. So asking for $9 million out of a $10 million grant to build a building is going to be a hard sell. It's not, like I said, it's not prohibited, but I would just sort of be, what is most prudent given the sort of parameters of this grant, supporting your target population, and just sort of the general circumstances. Again, I am not a decision maker. You put the proposal together, whatever you need it to say, but just as a thing to think about. And if you do, whatever you put in there, make sure you can really explain the necessity. So the next question is, let's see here. Is there a word limit for the text boxes? The answer is no. They should be unlimited. If you do, for whatever reason, run into some funny, you're not getting all your text in and it's cutting you off, let us know and we'll make sure we fix that. But they should all be unlimited text fields. So write to your heart's content. Another question was, can the target population qualify in both ways? Can you have a target population that is both 4 or more bookings or frequently criminal justice involved and involved with their healthcare systems and institutional placements? So you can have both the bookings and otherwise and frequently criminal justice involved. The answer is yes. There's no reason that you can't be in both categories, and I'm sure many people are, but I would think about, if you are able to describe your target population in that 4 or more bookings capacity, it's good data to have. So I would I would encourage folks to be able to explain, what overlap there is or why you were deciding to try and define your target population in both ways, so that the grant review committee is very clear on your methodology, because that is one thing that they will need to understand is, who is your target population? The 4 or more bookings makes it pretty clear. That's how we got there. That's 50 people who are booked 4 or more times. They have 1 or more behavioral health disorders, etc. But if they are both that and frequently criminal justice, hospital healthcare, institutionally involved, just make sure you're very specific about why they are both, as opposed to choosing one. And let's see here. Next question is there a funding cap per application? Nope, there is not. You may ask for whatever funding you desire, whatever you need. I would be, one thing to think about, of course, is there's $10 million, and just be able to justify all of the components of your application. If you ask for 2 staff people and X amount of equipment, just be very specific as to what those pieces will do, so that the grant review committee, if the grant review committee is having to consider your application and maybe more funding requests came in than funding is available, they're going to have to make tough decisions, and they should be able to tell clearly from your application, what components you need to do what. So just make sure you can justify all of the things that you've requested somewhere in your narrative, so that they're not guessing as to why you asked for all this equipment you never explained. Just be really sure that if you ask for something in the budget sheet, it is shown up as part of your plan in the narrative forms. Let's see here. The next question is this PowerPoint available for us to use at our LIPSICs? Absolutely. This is available to anyone who wants to. The slides are available to anyone. This webinar recording is available to anyone, and your staff has done a number of in-person back when that was okay, and virtual now that that's what we're doing, presentations to LIPSIC. So if you want staff to come in and talk to your LIPSIC, that's fine. Or if you have any questions, please feel free to reach out. But yes, all of our materials you can use and show your LIPSIC and get them as much information as you want. Same is true of any tribal government as well. You're welcome to use all of this stuff. Next question is the tribal set-aside amount for the one tribal applicant is the tribal set-aside amount for the one tribal applicant that is required, or is the set-aside going to be dispersed to any of the 9 tribes of Oregon who apply? So is the set-aside already dedicated to one tribe, or may any of the 9 tribes apply for the tribal set-aside funds? The answer is any of the tribal governments interested in impacts may apply for the tribal set-aside funds, and if the applications come in and the request from tribal governments exceeds the amount that was set aside by the Grant Review Committee, the Grant Review Committee may choose to allocate more funds to the tribal government set aside. It's not as though that whatever decision they make on this, the amount of funds to be set aside is the last conversation. They are totally free to increase that available funding for tribal governments if it's warranted and if they choose to. So let's see here. Next question. Okay, that actually looks like the last question. So thank you for bearing with this little recording. Please reach out to any one of the impact staff. We've got staff at CJC, Casey Lewis, Angel Perrin, me, Bridget Budbill. We've got staff at OHA, Kate Grover, and then we have Madeline Dardeau at Council of State Governments, who is a technical assistance provider. All of us can help you, fill this stuff out and answer any of your questions. So if you have any remaining questions, please let us know anytime. Here's my email, and thank you very much, and have a great day.